We're now looking at the interior of the knee joint. We see the thigh bone on the top, the shin bone on the bottom, and the inner or the medial meniscus cartilage here. You can see tearing of this medial meniscus cartilage. You see how that rolls out there, indicating a horizontal cleavage tear, and then these jagged flaps over here on the right. We also notice a good deal of articular cartilage damage on the femoral condyle, but we'll get back to that in a minute. Inserting the motorized shaver into the joint allows us to begin to address this torn medial meniscus, and we're going to stabilize this meniscus all the way out and underneath to the synovial meniscal junction. Want to get the jagged flaps back here cleared out, and there's some articular cartilage on the tibia right here that we're clearing out as well. So we're coming around to the posterior horn now. Get that smoothed down. A little bit more. So we've got this meniscus cleared out. You can see some articular cartilage damage on the tibia, but now we're going to look at the articular cartilage status on the femur. We're going to straighten the leg out. A little roughness here, which we'll smooth out. Okay, now we're going to flex it on back. We're just going to slip on back behind the knee. Slipping through this little crack here. So we're posterior medially, pushing up from behind. That looks fine. Rotating the scope centrally and withdrawing. A little bit of synovitis there, but there's the posterior cruciate ligament as we come on out. There's the anterior cruciate ligament, and that looks fine there. Now we're going to slide on over into the lateral compartment of the knee joint. It also has a lateral meniscus, but there's some damage on the femoral condyle, which is pretty significant. Going to get the motorized shaver in here, and we'll begin to smooth this out. A little roughness of this lateral meniscus here. This is sort of a disc-shaped lateral meniscus, I think. And we'll get this tear trimmed out back here. And you can see the articular damage on the tibial surface right along in here. We're getting this central area nicely smoothed off there. And now we're going to work on the tibia, on the femoral surface here. Want to get these jagged flaps smoothed out. And then more laterally, there's a jagged flap right here. Now we're getting into good articular cartilage. We'll flex the knee back a little bit right there. A little bit more. And to get the posterior aspect of this damage smoothed out. So we've got the lateral meniscus debrided and the lateral femoral condyle and tibial surface debrided. Now we're going to slide back behind the knee and look posteriorly and laterally. So we're now posterior and laterally, pushing up from behind. That looks good. Rotating the scope centrally and withdrawing. We now see our main stabilized knee ligaments. The next step is to look at the kneecap from above. So now we've positioned our scope above the kneecap. That's this white structure we're pushing up and down on here. We're going to slide on over into the lateral gutter. Look for loose bodies as we slide down the lateral gutter. A bit of synovitis there, which we'll remove a little bit of the synovial tissue, these little bulbous fronds here. Got that cleared out. Now we're down in the area of the lateral meniscus. That looks fine there, no loose bodies. Now we're coming on up the lateral femoral condyle, looking over into the trochlear groove. You can see the undersurface of the kneecap right there is bare of bone. And so we're going to look down into the trochlear groove, and you can see that's also bare of bone there. And now we're going to slide on over and pull that back a little bit, please, into the medial gutter. And a bit of synovitis over here, which we'll use the shaver to clear out. Okay, now backing on up, we're going to swing around up into the pouch. Making sure that's nice and smooth. A bit of synovitis right here, which we'll clear out. And over here laterally. Okay. Now we'll redirect our scope and look up again, and you can see the kneecap once again. And this concludes the arthroscopic surgical procedure.